Hey everybody, welcome to NURS155, Basic Medical Terminology. Today's overview is Chapter 7, the respiratory system. So let's get right into it. The structure and the function of the respiratory system. So the structure typically begins with the nose and leads its way down into the lungs. Okay, so the nose, the pharynx, which is commonly called the throat, the larynx, which contains the vocal cords. So when we talk about two conditions that happen to patients, pharyngitis and laryngitis. Pharyngitis is a sore throat for all intents and purposes, inflammation of the throat. And then laryngitis is inflammation of the vocal cords. Okay. The trachea is the windpipe. That's what channels air into the lungs. And it's lined with cilia. And cilia act they're like hair-like projections, very small, very fine. And what they do is they act to remove contaminants before they get to the lungs, before air gets into the lungs, and to also help to move water over tissue surfaces. Okay. The respiratory system, the lungs, 3 lobes in the left lung, 3 lobes in the right lung, 2 lobes in the left lung. The top of the lung field is called the apex. Okay, and then the very bottom, if you looked at maybe an X-ray and you see these pointy projections on the bottom lateral borders, that's called the costophrenic angle. Okay, the lungs, the pleura is a membrane that encloses the lungs 2 layers, the visceral and the parietal layers. Okay. The pleural cavity is the area between those 2 layers. And then the mediastinum, media being middle. The mediastinum is the space between the lungs and the heart. That particular area, it kind of separates the lungs from the heart and the pericardium and the thoracic aorta. And then that leads into the thoracic cage, okay, the upper chest. The thoracic cage encompasses things like the sternum and the xiphoid process, or the xiphoid tip, which is what is at the bottom of the sternum, the most inferior point of the sternum. That xiphoid tip is what we try not to break if we have to perform CPR on a patient. The ribs, 10 pairs of ribs that are in the upper portion of the chest, and those are connected with cartilage. And then there's 2 pairs of floating ribs at the inferior part of the thoracic cavity, and those are not connected to that cartilage that connects the other 10 pairs. Okay? External respiration and internal respiration. So external respiration is the exchange of gas in the lungs, and internal respiration is the exchange of gas in the tissues. Okay, some of the terms: auscultation, the listening, okay, hearing. Typically when we listen to lung sounds, it's with a stethoscope. So when a provider has placed a stethoscope on your back and says, take a deep breath in, blow it out, take a deep breath in, blow it out, they're listening for lung sounds. They're auscultating those sounds. Cyanosis, another common one, right? That bluish condition, cyan being blue, osis being condition or condition of. Dyspnea, PNEA is breathing. Okay, so that is the root in dyspnea. DYS explains the condition of breathing or the respiratory system. DYS is painful or difficult. So dyspnea together is painful, difficult, short of breath, which would be difficulty breathing. Okay. Hemoptysis is another good one. Excuse me. Coughing up blood, hemoptysis. Okay. Orthopnea, that's another good one. Orthopnea, breathing discomfort that's relieved by sitting upright, meaning orthopnea is when somebody is having difficulty breathing when they're laying on their back. Palpation, another physical exam technique. We had auscultation. Palpation, or to palpate, means to touch. Typically, we use our hands to do that. Percussion is a way of tapping to elicit body sounds. Okay, another exam technique. The respiratory rate is the number of breaths per minute. Normal in adults is typically 12 to 20 respirations within a minute. And a full respiration is a full inhale to a full exhale. One respiration. We count those for a full minute. And again, for adults, 12 to 20 is considered normal. Apnea, you guys have all heard that one, right? Apnea, P-N-E-A, referring to breathing or respiratory function. A being absence of, apnea. Sleep apnea, absence of breathing while sleeping. Bradypnea, just like previous when we talked about the cardiac system and we had bradycardia, slow heart rate, bradypnea is a slow breathing rate, which would be something below, in an adult, below 12 respirations per minute. Tachypnea is the opposite, more than 20 respirations per minute, okay, which would be something like hyperventilation, okay? And the different breath sounds that we listen to or providers are listening to when they're doing auscultation would be things like crackles. These are probably the four common breath sounds. Crackles, a high-pitched breathing sound. Rhonchi, a low-pitched breathing sound. Wheezes, a high-pitched whistling sound. And then stridor, which is a harsh, a very harsh kind of sound, like somebody that has really bad pharyngitis or a really bad sore throat. Okay, different diagnostic tests that we use for the respiratory system. Pulmonary function tests, probably the most common. We do these oftentimes for certain physicals, employment physicals. Personally, I used to do PFTs when I lived in Colorado. I did PFTs for a company that did yearly physicals for their employees that worked in mines in the Rocky Mountains, and they would want to check and make sure that these miners were not developing any respiratory disorders. So we would perform PFTs. What pulmonary function tests give us is information, a lot of information, about the lungs, okay, and about the respiratory system. Some of the different things that are in a PFT, something like the forced expiratory volume, the FEV, other things that we look at, the inspiratory reserve volume. So it's really looking at, a PFT is really looking at the lungs' ability to take in oxygen and withdraw oxygen and its overall functioning of the lungs. Okay, different radiologic tests that we do, obviously chest x-rays, we do MRIs of the chest, CT scans of the chest, pulmonary angiography and arteriography using contrast dye to attach to certain structures inside the respiratory system so that we can see those or view those better. Okay, arterial blood gas, another one, bronchoscopy, using a camera to visualize the tracheobronchial tree. Okay, different culture and sensitivity tests. Yes, we do cultures to find, in particular, bacteria or organisms that may be growing in our respiratory system. So oftentimes what that requires a patient to do is to maybe cough up what we call sputum, so something from deep inside, so not spit, but deep inside, and to get that out and then send that to the laboratory for analysis, and we'll do a culture on those. Lung biopsy, probably, it's obviously an invasive procedure and probably something that we would do in very serious cases where we would want to get a little piece of the lung and remove that and have that evaluated in a laboratory to determine things, which would be tissue, right, lung tissue, to determine things like possible lung cancer. Okay, you guys can look at some of these, some of the conditions that we see. So this one's good. Arterial blood gases, or ABGs. Look for things like respiratory acidosis, alkalosis, metabolic acidosis, and metabolic alkalosis. So these are conditions that affect the respiratory system's ability to function efficiently. Okay. Other tests that we do, pulse oximetry, non-invasive. We do a pulse ox. Some of you guys have probably had that done. We put that little clip on a finger, and we are looking at the oxygenation of blood in the system. So we're looking at the respiratory system oxygenating our blood into our circulatory system. Sputum analysis, that was what we just talked about with the cultures. And then a thoracentesis is using a needle to withdraw or aspirate a sample of fluid from the parietal cavity, and then examining that fluid in the laboratory. Major respiratory disorders, acute bronchitis. Okay, so acute bronchitis, a sudden onset is what acute means. So sudden onset of an inflammation of the bronchi, which could make it difficult to breathe. Acute respiratory failure, ARF, again, a sudden onset of the respiratory system failing. Okay. Acute respiratory distress syndrome, a form of pulmonary edema or swelling leading to respiratory failure. Asbestosis, lung inflammation caused by inhaling asbestos. Okay. Atelectasis. Atelectasis is a fancy term for a collapsed lung. Okay. Chronic obstructive pulmonary disease, COPD, probably the most common term that you're going to hear when we talk about respiratory system disorders. COPD, it is a group of diseases that's marked by decreased airflow or resistance to airflow. So things like asthma, very common, right? Airway obstruction from bronchospasm caused by bronchospasms. Chronic bronchitis. Chronic, opposite of acute, right? Acute being sudden onset. Chronic means that it's always there. Now, can we have a condition that's both chronic and acute? Yes, we can. So if you think about it, somebody who has chronic bronchitis, that means that bronchitis, that inflammation of the bronchi is always there. But a patient can have acute flare-ups of bronchitis, really bad moments of having their bronchitis. Maybe something that exacerbates or promotes them having really serious breathing issues. You could have chronic bronchitis accompanying, or acute bronchitis accompanying somebody's chronic bronchitis. Okay, emphysema, destruction of the alveolar cells or walls. This is emphysema is commonly linked to things like cigarette smoking. Okay, cystic fibrosis is a good one. Genetic disease of the exocrine glands that causes really heavy mucus production. Okay. Oh, let me go back to hemothorax. That's a good one. Another common one. Hemothorax. Heme being blood in the thoracic cavity. In this one, it's blood that fills the pleural cavity. Okay, in the thorax. Others, hypoxemia, deficiency of oxygen in arterial blood. Hypoxia is a deficiency of oxygen at the cell level. Okay, lung abscesses, lung infections with pus or purulent drainage. Okay, pleural effusion, fluid collection between that visceral and parietal pleura. Okay, and then a pleurisy. Another one, inflammation of the pleura, usually causing very serious chest pain. Pneumonia is an acute infection Pneumonia is probably the most common cause of death in older adults in particular. Usually that's going to be one of the things that we chalk up to why somebody dies in older age, typically is from pneumonia. Okay, pneumothorax, air collection in the pleural cavity, pulmonary edema, excess fluid which accumulates in the lung tissue and the alveoli. Pulmonary embolism is a blood clot that obstructs the pulmonary artery. Very serious condition. Okay. Let's see. How about things like sarcoidosis? Now, I said I was going to break down a few of these words. Sarcoidosis. Sarc, S-A-R-C, means tissue, or tissue, well, it means tissue. Oid, O-I-D, means resembling. So this one, and then osis is condition of. So this would be resembling tissue, sarcoidosis. So it says it's a systemic disease with granular lung nodules. So these nodules form. They may or may not be serious, may or may not lead to problems, but sarcoidosis is a creation of tissue-like material. Okay. And then tuberculosis, infectious lung disease caused by the Mycobacterium tuberculosis. Obviously, all of us that work in healthcare are going to undergo tuberculosis screenings on a fairly regular basis. Okay. Different devices used to treat disorders. Bronchoscope, which is used to visualize the bronchi, possibly aid in removing foreign objects. A chest tube inserted into the pleural space, typically to relieve swelling, edema, or fluid. Okay, an ET tube, an endotracheal tube, inserted into the trachea to deliver oxygen to a patient that's not breathing on their own. Nebulizers used to deliver moisture and medication to the lungs. We do a lot of nebs, in particular in family practice, or lost my train of thought. Stethoscope used to auscultate the lungs. Okay. Surgical and invasive treatments. Pneumonectomy is the lung removal. Okay. Thoracentesis, I think we mentioned that one earlier. Needle puncture into the chest to drain fluid from the parietal cavity. Okay. Different things like thoracostomy and thoracotomy. I kind of like the ostomy versus otomy. Very similar terms and similar functions, but ostomy as a suffix, which explains a procedure. Ostomy, if we can remember surgical opening, a lot of times the way I look at it is that ostomies as a surgical opening, a fair amount of times, an ostomy is something that may be permanent or long-term, whereas an otomy as a suffix usually means surgical incision, typically is a shorter duration of having that incision open. Okay, so that's how I kind of remember the two. Very similar, though. Okay. Different ventilation therapies, mechanical ventilation. This is when we talk about when we've had to deal with COVID-19, and we know that we had a significant need for additional ventilators. Ventilators are artificial forms of breathing for a patient. Okay. Different drug therapies for respiratory disorders, antitussives or cough suppressants. Okay. Anti, always meaning against. Okay. Antihistamines, used for things like seasonal allergies or allergic reactions. Corticosteroids are used to reduce inflammation. Okay. Decongestants to relieve swelling. Expectorants help to decrease the thickening of mucus so that we can get rid of, thick mucus. Okay. Other therapies, aerosol treatments, delivers drugs by nebulizer. Okay, deep breathing exercises, oxygen therapy. All right, and that's it. So that will do it for Chapter 7, the respiratory system. I look forward to seeing you for Chapter 8.